This is Pick Your Poison. I'm Dr. JP, ER doctor, toxicologist, and unapologetic lover of all things poison. This is an interactive show, so your decisions matter. Every choice you make shapes what happens next. Will our patient survive? That's up to you. Want to know what causes fire eater's lung, what disease you can get from sitting in a hot tub, and how you can be poisoned by stealing gasoline? Grab your stethoscope and let's go to the emergency department. Your patient is a 16-year-old boy with a chief complaint of cough. You enter the room and see the patient sleeping on the stretcher. Surprisingly, there are no parents at the bedside. His vital signs are as follows. He's afebrile with a temperature of 98.6 or 37 Celsius. His heart rate is 120 beats per minute with a blood pressure of 120/80. His respiratory rate is 25 and oxygen saturation 94% on room air. You give him a gentle shake. He wakes up and opens his eyes. You ask what's brought him to the emergency department. He says the cough, it started an hour ago. It's been severe. He's now having chest tightness. And he came to the emergency department because he started becoming short of breath. He denies other cold or flu symptoms like congestion or runny nose. He hasn't had a fever or chills and denies all other symptoms. His chart says he has no past medical history. And when you ask him to confirm, he says no prior history of asthma or other lung disease. He doesn't take any medicines and hasn't been using any supplements or over-the-counter medicines. He doesn't have any allergies, and he denies tobacco, alcohol, and illicit drug use. You ask about his parents. He said his dad is away on a business trip and his mom should be coming to the hospital shortly. You take out your stethoscope to examine him. Other than the fast rate, his heart is normal. He doesn't have any abdominal tenderness. You have to shake him awake to get him to sit up so you can listen to his lungs. You hear crackles, but no wheezing. His extremities are normal, without any swelling or edema, and he has good muscle strength. What are crackles in the lungs? It's a noise just as described. It's a crackling. If you want to hear what it sounds like, you can rub your hair between your fingers next to your ear, or think of the sound of like crinkly paper, but if it was more quiet than that. So there's something in his lungs that doesn't belong there. And that's question number 1. What do crackles indicate? A, asthma? B, a heart valve problem? Or C, fluid in the lungs? The answer is C. Generally speaking, it means fluid in the lungs. If someone has asthma, you hear wheezing. If they have a heart valve problem, you'd hear a heart murmur. A common cause of crackles in the emergency department is pulmonary edema, meaning fluid in the lungs, for example, from heart failure. Occasionally, it can be due to pneumonia, though often you hear rhonchi, which is a description of coarse lung sounds. Crackles can indicate inflammation. In his case, you hear the crackles in both lungs, so it's less likely to be a focal pneumonia and more likely to be widespread. Essentially, we have a sleepy teenager with a rapid heart rate, rapid breathing, a borderline oxygen saturation with crackles in his lungs. So how do we get to the bottom of this? Well, the first and most useful step is going to be a chest x-ray. But we have another issue to address first. In the United States, if you're under 18, generally speaking, you need the permission of a parent to treat the child. You ask the patient if he can call his parent. I like using the patient's phone better than using the hospital phone because these days people never answer numbers they don't recognize. Mom answers on the first ring. Wind is whipping around in the background and she sounds very frazzled. She tells you she's on her way in, but she's having some car problems and will be there as soon as possible. In the meantime, she gives you permission to treat and evaluate him. So you order the chest x-ray. You could order some basic lab work. It's kind of 50-50 here. You might order it now or you might wait to see what the chest x-ray shows. What about the patient's mental status? Why is he so sleepy? Well, we've discussed in the past respiratory failure from things like asthma and COPD causing hypercapnia or an elevated carbon dioxide level, resulting in altered mentation, anything from agitated to psychotic to completely unresponsive and comatose. Is that what's happening here? Do we need a blood gas to take a closer look? Well, it does seem odd he's a little sleepy, but he doesn't seem truly altered or somnolent. He wakes up as soon as you shake him, and he answers questions appropriately. So I'd be doubtful it's significant hypercapnia, though I am still wondering what might be the cause. The chest x-ray comes back showing bilateral interstitial infiltrates. What does this mean? Well, it generally indicates fluid in the lungs. Those are the crackles that you were hearing on his lung exam. The cause of the fluid can be several different things. As I said before, it's common in the emergency department for this to be pulmonary edema from heart failure. It's not very likely in our otherwise healthy teenager, and he doesn't have other signs of too much fluid on exam like swelling in his ankles, etc. Commonly, especially these days, it can be an atypical pneumonia. COVID causes it. So yes, he did have a cough. He has some shortness of breath with rapid breathing and a low oxygen saturation. Those can be consistent with pneumonia, but it doesn't really make sense because he wouldn't have developed pneumonia or a significant COVID infection in the past hour. I mean, that takes days, so I don't really love pneumonia as an explanation. Also, he hasn't had a fever. I'd be very suspicious this is pneumonitis. What's pneumonitis? Essentially inflammation in the lungs. And as with inflammation anywhere, you get fluid buildup. Think about a sprained ankle that's swelling, but in this case, the fluid is in the lungs, seen as interstitial infiltrates. What causes pneumonitis? Well, tons of different things, and definitely a lot of toxins are on the list. Pneumonitis can be from hypersensitivity reactions, essentially like an allergic reaction, to some things like mold or bird droppings. The bird one has a funny name called bird fancier's lung. Autoimmune disease can cause pneumonitis. And I just learned about a new one doing this episode called hot tub lung, where patients get hypersensitivity pneumonitis from inhaling bacteria in contaminated hot tub water in steam. So it seems like a hypersensitivity reaction to the bacteria rather than a really true infection, because in many cases just avoiding the hot tub is enough to prevent symptoms. Occupational exposures are always on the list for pneumonitis. These are also given colorful names like farmer's lung, quartz worker's lung, mushroom worker's lung. Farmer's lung occurs probably from exposure to moldy hay. Mushroom worker's lung from dust and spores in the compost used to grow the mushrooms. Medicines can definitely cause pneumonitis. Chemotherapeutic agents are at the top of the list. Amiodarone can do it, a drug for heart rhythm control. You ask the patient about hot tubs and bird watching, he gives you a funny look and says, no. He says he doesn't work and again says he isn't taking any medicines. There is one really common cause of pneumonitis in teenagers. Well, maybe common isn't exactly the right word, but incidence of this type of pneumonitis is definitely on the rise in this age group. And that's question number 2. Is the pneumonitis in teenagers due to A, marijuana, B, synthetic cannabinoids like K2, C, alcohol, or D, vaping? The answer is D, vaping. Listen to the miasma episode for more details on this. I'm sure you know different substances can be vaped, including tobacco and marijuana. The pneumonitis doesn't seem to be directly related to either of those because smokers of those substances don't get pneumonitis. And the truth is we don't know exactly what's causing pneumonitis in people who vape, but it's thought to be due to the diluent, i.e. the liquid inside the cartridges that the tobacco and the marijuana are dissolved in so they can actually be vaped. Pneumonitis caused by vaping is called E-valley, meaning e-cigarette vaping is associated lung injury. And it can be life-threatening. It's been responsible for at least 50 deaths. People definitely can survive, but some have required double lung transplants due to the severity of the pneumonitis. So when you have a teenager with pneumonitis without risk factors like occupational exposure, medicines, etc., my concern about vaping as the cause would be very high. Our patient initially denied tobacco and marijuana, but I'd go back and ask him again. Teenagers often have a lot of reasons for denying substance use. The patient is sleeping again when you get back to the room, but as before, he's easily rousable. He adamantly denies vaping, saying he had a friend who had breathing problems as a result and would never use it himself. You notice his oxygen saturation is drifting down. It's now hovering around 92%, which is just barely above the cutoff where he'll need supplemental oxygen. We give it usually at 91% and below. What's the treatment for pneumonitis? Essentially supportive care. If there's an underlying cause like autoimmune disease, the first step would be to treat that. With a toxin, of course, the first step would be to withdraw exposure. You can give oxygen if the patient becomes hypoxic. Often patients get better with supportive care, but occasionally pneumonitis can progress to ARDS or acute respiratory distress syndrome and complete respiratory failure. If our patient had that, of course, we'd intubate and put him on a ventilator. Occasionally, patients can get lung transplants, although, as I said, this is quite rare. So it isn't clear what's causing his pneumonitis. It is clear he needs to be admitted to the hospital. His respiratory rate is now in the 90s, and as we just noted, his oxygen rate is dropping in just the few hours he's been in the emergency department. It'd be worth doing a COVID and a flu swab, though this doesn't seem a likely cause, and they come back negative. Some people might treat with antibiotics just in case there was an infectious bacterial cause. That can be hard to know with 100% certainty during the initial workup. You're in the room with the patient to discuss the findings when the curtain whips open. A woman runs through saying breathlessly, "Hi, I'm his mom, what's going on?" She has makeup smudged around her eyes, and her hair's escaped from its bun in a halo of frizz. She rushes to the bedside. You discuss what's happening with her, the findings of pneumonitis, the uncertainty as to the cause, and the definite need for hospital admission. She confirms that the patient's never vaped, doesn't smoke, and doesn't have any prior history of lung disease, not even in childhood. As you exit the room after the discussion, you hear her say, "What were you doing with my car? I slipped and almost fell in the huge puddle of gas on the ground, and the tank was so empty the car wouldn't even start." You stop in your tracks with an idea about what might have caused the patient's pneumonitis. Question number 3, and time to pick your poison. Are the patient's symptoms caused by A. Motor oil, B. Gasoline, i.e. fuel or petrol, C. Windshield washer fluid, or D. Antifreeze? The answer is B. Gasoline, i.e. engine fuel or petrol. Antifreeze is often a toxic alcohol, which, as you know from prior episodes, causes severe toxicity but not pneumonitis. Motor oil doesn't really cause pneumonitis for reasons I'll come back to in a few minutes, and the ingredients in windshield washer fluid vary, but typically it's water and regular alcohol, i.e. ethanol. Our patient's sleepiness and pneumonitis are consistent with gasoline exposure. And a quick word for those outside the US, we call fuel gas for short, so here gas refers to fuel or petroleum, not something in the air. What is gasoline? Well, it's a hydrocarbon. We've talked about these several times. Ethanol itself is a hydrocarbon, as are things that people use for huffing and sniffing. Gasoline is a mixture of more than 500 hydrocarbons and additives. You ask him about gas exposure, as does his mom, and he doesn't say anything. In fact, he pretends he's asleep. As any practitioner of adolescent medicine knows, this is not an uncommon scenario when dealing with teenagers. We talked about sudden sniffing death when hydrocarbons cause sudden cardiac arrest. Listen to the deadly breath equals sudden death episode for more, but it doesn't fit here. Could this have been a suicide attempt? He opens his eyes to say no to that, and mom confirms his mood has been normal at home. What happened? You actually have a good guess because this is a pretty common scenario. You ask if he was siphoning the gas. He squirms uncomfortably, closes his eyes for a few minutes, then opens them to look at his mom. Finally, he says, "Yeah, my car needed gas, but I didn't have any gas money, so I thought I'd just siphon some of my mom's off the top of the tank to get where I needed to go." Is siphoning gas dangerous? Actually, yes. Let me explain first what I mean by siphoning. People who do this stick a tube, like a hose for example, down into the gas tank of one car. They put the other end of the tube in their mouth and suck on it to start the gas flowing, to quickly transfer the hose into a second car or a second gas tank. The idea is to take the gas from one tank to the other. And you suck on it to get the flow started. You're supposed to suck on it, but get it out of your mouth before any gas actually gets into your mouth. But this never works as well as people assume it will, and oftentimes they do suck the gas right up into their mouth. So do they get sick from swallowing the gas? Actually, no. If you drink gas, and I really don't recommend this, but it's not particularly dangerous in and of itself. It does cause a lot of nausea, vomiting, and diarrhea. As you can imagine, it's a gross, oily liquid moving through your gastrointestinal tract. But in and of itself, if it's only in your GI tract, it isn't otherwise significantly toxic. The issue arises with aspiration into the lungs, and it's pretty common when you're siphoning gas because, as you can imagine, when the gas gets into your mouth, you start to cough and gag and spit it out because it tastes disgusting. In addition, gas is volatile, so it's very easy for it to get into your lungs if it's in your mouth. And it's in the lungs where it's very toxic and causes pneumonitis. When you ask what happened, he said, "Yeah, I was trying to get that gas out with a hose. I started sucking on it, and it exploded into my mouth. I tried to spit it out, but it made me cough and gag because it was so gross." All right, so now we know the cause of the pneumonitis. It's caused by the gasoline. Does that change our treatment plan? No, the treatment is the same. This is inflammation for sure rather than infection, and the treatment will be supportive care. Specifically oxygen if his oxygen saturation gets any lower. People have tried steroids to reduce inflammation, but it doesn't seem to help. You call the intern on the pediatric service to get the patient admitted to the hospital. The intern asks, "Can you pump his stomach?" That's question number 4. A, yes. B, no. The answer here is definitely no for 2 reasons. First, we've discussed before if you pump the stomach, that's gastric lavage in medical terms, you need a reasonable expectation that the toxin is still in the stomach. The patient says he tried to siphon the gas about 4 hours ago. Obviously, gas is a liquid, and liquids are rapidly absorbed, staying in the stomach typically for less than an hour. It's doubtful there's any gas still there to pump out. No, it's not uncommon for patients to come in immediately after siphoning gas. Would this change your opinion? The answer is again no. Gastric lavage actually increases the risk of aspiration, meaning it increases the risk of getting the gas into the lungs. And as I said earlier, gas in the stomach doesn't cause significant harm, but if you tried to pump it out, you increase the risk of aspiration and thus increase the risk of, or potentially worsen pneumonitis, doing more harm than good. I would strongly advise against siphoning gas with your mouth. If you need to transfer it, get a pump or use some other method of suction. That said, even after exposure to gas, most people are fine and only about 15% develop pneumonitis. Let's change the scenario for a minute and say he rushed into the emergency department right after siphoning. You do a chest x-ray, it's negative, he has normal vital signs. Would you send him home? That's question number 5. A, yes, or B, no. The answer is B, no. Pneumonitis takes time to develop because it's inflammation, and it takes time to be able to see it on the chest x-ray. So after hydrocarbon exposure, observation for 6 hours is recommended. And in patients who don't have symptoms or vital sign abnormalities, I'll wait until the end of the 6-hour period to get the chest x-ray, giving the pneumonitis time to develop before I decide to discharge somebody. Even then, even if you do discharge them after a 6-hour observation period, you have to give strict return precautions because it's possible for the pneumonitis to develop at 8 hours or even later. So, how do hydrocarbons injure the lungs? Well, first, they directly injure the alveoli. These are the sacs inside the lung which make up the lung surface. When the alveoli are injured, fluid leaks inside them and into the spaces in between them. Hydrocarbons inactivate surfactant, material that helps keep the alveoli open, making it easier to breathe. An inflammatory response is triggered, which is the pneumonitis we see on the x-ray. If the fluid accumulates to a severe degree, then the lungs have the reduced ability to absorb oxygen, causing hypoxemia and ultimately respiratory failure. Okay, so back to our patient. What's his risk of developing complete respiratory failure with this type of pneumonitis? Fortunately, it's only about 5%. Most patients do well. And why is he so sleepy, did I hear you ask? Is that the gas or something else? Well, hydrocarbons can cause an altered mental status. Gasoline doesn't cause as much alteration as some other hydrocarbons, so I wouldn't expect him to have a coma, for example, but the sleepiness is definitely consistent. As you can imagine, there are many different kinds of hydrocarbons people can be exposed to. I decided to use gas in this case because it's so common, but in many places a similar ingestion would be exposure to lamp oil. What's lamp oil? It's another hydrocarbon. The composition again can vary. Sometimes it's kerosene, paraffin, can be a mixture of things. Paraffin is essentially refined kerosene, meaning it burns cleaner and it's better for inside use. The World Health Organization recommends kerosene not be used inside due to increased risk of asthma exacerbations and cancer, but it is fine for use outside in things like camping lanterns. Who gets lamp oil exposures? They're not uncommon in the US. Poison centers get tens of thousands of calls a year, and they're even more common worldwide. Most of the time, it's a pediatric ingestion in children, around 2 years old, who mistake the liquid for a drink. Some lamp oils are very brightly colored and attractive to children as a result. Also, we've talked before about storage of things in Snapple bottles, and lamp oil has been stored in Coca-Cola bottles or water bottles, confusing thirsty children. There are conservative religious groups in the US who don't use electricity at all, or who don't use it on certain days of the week, and it's often in these populations that you see the lamp oil exposure. Around the world, actually, kerosene poisoning is one of the most common accidental poisonings, by some accounts representing 14 to 60% of admissions due to accidental poisoning in children. All right, question number 6. This is a kind of a cool one. There's a very rare occupational exposure where patients get pneumonitis from hydrocarbons. Is it A, in fire eaters, B, in asphalt workers, C, in marina workers, or D, in gas attendants? The answer is A. This risky occupation can result in what's called fire eater's lung. And that's because people who do shows with fire breathing use oil to breathe fire, and of course the oil is made of hydrocarbons. It's usually a mixture of things, sometimes it's kerosene. These performers are definitely at risk for aspirating the hydrocarbons and developing pneumonitis and the same symptoms as gasoline or lamp oil ingestion. What happens with lamp oil ingestion? Essentially what happened to our patient. Drinking it isn't particularly toxic inside the GI tract other than vomiting or diarrhea, and as with gasoline, the risk is with potential aspiration. If a child does drink it, the recommendation is to go to the emergency department for vital signs, including pulse ox monitoring, observation, and a 6-hour chest x-ray. If everything is fine, they can be discharged. If not, they're treated supportively like our patient. If you do have an oil lamp or kerosene lamps or heaters in your house, please make sure to keep the oil away from children to prevent accidents. Ingestion and aspiration isn't the only route of exposure that can cause pneumonitis after hydrocarbons. Interestingly enough, several patients have injected gasoline intravenously or under the skin, leading to systemic toxicity and pneumonitis. Oh, and I mentioned that I would come back to motor oil. Motor oil is a hydrocarbon. It's pretty similar to gas, but it actually doesn't cause pneumonitis because it has a high viscosity, meaning it's thick and therefore not likely to be aspirated. In medicine, we used to use mineral oil, another hydrocarbon, to treat constipation, and while it works pretty well for the reasons I mentioned above, it's fallen out of favor due to the risk of aspiration and lung injury. How much hydrocarbon does it take to cause pneumonitis? Well, not very much, actually. Aspiration of less than 1 millimeter of kerosene into the lungs is enough to cause toxicity. There are some interesting radiology findings associated with kerosene ingestion. A double gastric fluid level was described in about 50% of x-rays after exposure. This is actually a visible layering in the stomach of the kerosene on top of the normal stomach acid. If you see this, it might be a clue as to what's happened. Back to our patient, he gets admitted to the pediatric service where they continue to monitor his breathing. His oxygen saturations drop down into the 80s, but he improves with supplemental oxygen. Fortunately, after a 4-day hospital stay, he's weaned off the oxygen and discharged without sequelae. This is a fictional case, as are all our cases, to protect the innocent, but it is based on real poisonings. Gas siphoning might be a timely topic as gas prices around the world are currently shooting up due to gas shortages from current political events. In 2002, when gas prices became high, the Greek state government television got into trouble with a video showing people how to siphon gas. Gas siphoning is always on post-apocalyptic shows like The Walking Dead. And if you want to be prepared for the end of the world, watch some YouTube videos showing you how to siphon gas without using your mouth so you don't end up with pneumonitis when there's no hospital or no supplemental oxygen. It should go without saying, please do not steal gas. Which brings us to the last question in today's podcast and our pop culture consult. Which celebrity jokingly said that he went to jail for siphoning gas? Was it A. Tom Holland, B. Michael B. Jordan, C. Justin Timberlake, or D. Justin Bieber? Follow the Twitter and Instagram feeds, both at PickPoison1 for the answer. Remember, never try anything on this podcast at home or anywhere else. Thanks for listening. It helps if you subscribe, leave reviews, and/or tell your friends. Transcripts are available at pickpoison.com. While I'm a real doctor, this podcast is fictional, meant for entertainment and educational purposes, not medical advice. If you have a medical problem, please see your primary care practitioner. Until next time, take care and stay safe.